This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello, and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, a senior attending here, and I'm joined today by our research fellow.
And I'm Dr. Alara. Today we're looking at a fascinating new study from the Journal of Neurology, Neurosurgery, and Psychiatry, published in 2026. The paper is titled, Comparison of Neuropsychological Side Effects Between Contemporary Radiofrequency Ablative Neurosurgery for Psychiatric Disorders and Conventional Neurosurgical Procedures, a Systematic Review and Meta-Analysis.
This is a timely topic, Ilara. We're seeing a shift in how the field views psychiatric intervention. For our residents and students listening, it's important to acknowledge the backdrop here. Psychiatric disorders are increasingly contributing to global disability on a massive scale.
Exactly. And while conservative management, pharmacotherapy, and psychotherapy has advanced significantly, we still face a high prevalence of treatment-resistant cases. These are patients who have exhausted standard protocols but are still suffering.
And yet, despite that need, neurosurgery for psychiatric disorders, or NPSD, remains remarkably underused. In the OR, we often discuss why the volume for these procedures doesn't match the clinical need. This paper hits the nail on the head regarding why that is.
Right. The authors point to two main barriers: strict regulations and historical concerns. Specifically, there is a lingering stigma regarding neuropsychological side effects, or NPSE. Many clinicians, and certainly the public, still associate psychiatric surgery with the era of crude, non-targeted procedures.
That historical ghost is what this study aims to address by focusing on contemporary techniques. Specifically, they are looking at contemporary radiofrequency ablative neurosurgery. For our listeners who may be more familiar with DBS or MRGF use, why is the focus on radiofrequency ablation here?
Because RF ablation is a cornerstone of ablative NPSD. The study performs a systematic review and meta-analysis to see how the NPSE profile of these contemporary psychiatric ablations actually stacks up against what we call conventional neurosurgical procedures, things like tumor resections or epilepsy surgeries that the medical community accepts more readily.
That's a critical comparison. If we accept the cognitive risks of a temporal lobectomy for epilepsy, why are we so much more hesitant about the cognitive profile of a contemporary capsulotomy or a cingulotomy for OCD or depression?
That's precisely the question the researchers are asking. They wanted to know if the fear of personality changes or cognitive decline in NPSD is supported by the data when compared to the baseline of conventional neurosurgery.
Looking at the paper's framing, they emphasize that these historical concerns are often what drive those strict regulations mentioned in the abstract. If the meta-analysis shows that the neuropsychological side effects are comparable to, or perhaps even less than, conventional procedures, it could challenge the regulatory landscape.
It would certainly change the conversation during informed consent. If a patient is treatment-resistant and facing a lifetime of disability, the risk-benefit ratio needs to be based on contemporary data, not 1950s history. The study focuses on contemporary RF, meaning modern stereotactic targeting and refined lesioning techniques.
It's about precision. We are no longer in the era of large, imprecise lesions. The neuropsychological side effects we worry about today are much more subtle, and this meta-analysis attempts to quantify them systematically across the literature.
And that's the key. By aggregating these studies, they're moving past anecdotal evidence of side effects and trying to provide a standardized comparison. It helps us answer whether contemporary radiofrequency ablative neurosurgery for psychiatric disorders is truly a special case of risk, or if it fits within the standard profile of modern neurosurgical intervention.
For our residents, it's a reminder that neurosurgery is as much about preserving function and cognition as it is about treating the primary pathology. Understanding the NPSE profile of NPSD is essential if we are to address the global disability these psychiatric disorders cause.
Definitely. It's a call to reevaluate our biases and look at the contemporary evidence provided by this meta-analysis.
Well, that's all the time we have for this segment. We'll be diving into the specific statistical outcomes of this study in our next episode. Thank you for joining us on the Neurosurgery Hub.
Thanks for listening.